Good morning. And to those of you who are in the audience and those of you by way of social media and certainly to my fellow commissioners, some that I cannot see, but welcome. At this time, we should call the meeting to order. Madam Clerk.
Chairman McLaughlin.
Present.
Vice Chair Coulson.
Here.
Commissioner Albright.
Here.
Commissioner Fitzpatric.
Present.
Commissioner Floyd Huggins.
Here.
Commissioner Nunnally.
Yes. Here.
Commissioner Ward.
Here.
Commissioner White. Here. Commissioner Perkins Williams.
Here. Here.
Everyone is present.
Thank you very much. At this time, we shall have the invocation and pledge, and we'll do that now. Gracious Father, we come, first of all, to say thank you. We thank you for this day. We thank you for life, health, and strength. Ask that you bless this county, bless the people that have been affected with this virus. Help us, Lord, that we might continue to do your will and do it your way. These blessings we ask in thy holy name. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. At this time, now we have a motion for the approval of the agenda.
Commissioner Nunley's hand is up.
Commissioner Nunley, motion to approve. Do we have a second?
Commissioner White's hand is up.
Commissioner White, second. All in favor, Madam Clerk?
Chairman McLaughlin.
Yes.
Vice Chair Coulson.
Yes.
Commissioner Albright.
Yes.
Commissioner Fitzpatrick.
Yes.
Commissioner Floyd Huggins.
Yes.
Commissioner Nunnally.
Yes.
Commissioner Ward.
Yes.
Okay. Okay, yes. Commissioner White.
Yes.
Commissioner Perkins Williams.
Yes.
Motion passes unanimously.
Thank you very much. At this time, we now have a public address to the board.
Mr. Chairman, yes, we have 8 people who are signed up for public addresses to the board. Your first one will be a call-in, and then the other remaining seven will be statements that I will read. They've been submitted via email. So if we can get our Public Information Office to queue us up to Keith Taylor, is our first public address to the board.
Mr. Chairman, I'll keep your time at 3 minutes per speaker or statement.
Thank you. Could you state your name and your address? Those who's going to speak, please.
My name is Taylor Keith. I live at 833 Country Club Drive in Aden.
Yes, sir.
Okay. On March 23rd of this year, 8 of the 9 commissioners of Pitt County heeded the advice of Violent CEO Michael Waldron. This was even prior to the order issued by Governor Roy Cooper on March 27th. According to the WITN article on March 23rd, Mr. Waldron stated it's like a hurricane. COVID cane is heading for us and it's a level 1 right now. On that day, 8 of the 9 commissioners of this board heeded that warning based on the data many people believe to be an extremely deadly situation. I strongly disagreed with the 8 of you that implemented your stay-at-home order on March 23, again, 4 days earlier than the governor's. We're now 6 full weeks into your order to choose what is and what is not essential. We're now 6 full weeks into people continuing to shop for groceries, hardware, sporting goods, takeout food, and many other things. We're also 6 full weeks into hundreds of hardworking small businesses not being able to work and provide essentials for their family and for their employees. The great news is that Mr. Waldron was one of 2 things. He was simply incorrect in his assumption that COVID cane was heading towards Vidant Hospital, or it was much like the Category 1 hurricane he described. Worth preparing for, caused some destruction, but not as devastating as it could have been. It is okay for politicians to be happy that it just wasn't as bad in North Carolina as the models predicted. While I continue to think this board made a terrible decision when putting the county shutdown in place, I believe you all have an opportunity to minimize the devastation you have put this county through. Don't forget you attacked this economy 4 days earlier than Governor Cooper. This board placed Pitt County 4 more days into this devastation than most of North Carolina. Now is the time for you 9 elected people to stand up for this county. Now's the time for you 9 elected people and for elected by and for Pitt County to tell Roy Cooper, we are able to open. Now's the time that you 9 people should think outside of partisan news stories and party talking points and tell the people of Pitt County that you believe in our ability to be safe. Now's the time you tell Roy Cooper that we believe folks that want to remain sheltered can choose to do that, while folks that feel comfortable getting back to work can choose to do that as well. As a citizen of Pitt County, I demand representation from the Pitt County Board of Commissioners. Thank you.
Thank you. Anyone else?
Okay, next we have a statement from Brandon Williams from Winterville. It says, Dear Representatives, my main question that I want answered in plain English without a link to a website is, why can't hair salons, nail salons, dentist offices, dog groomers, and a large number of other businesses be trusted to practice the same social distancing standards as grocery stores, home improvement stores, and gas stations? I know you're concerned, as I am, about the well-being of the people of North Carolina, as well as the entire country, but well-being includes mental along with physical health. Forcing people out of employment has extremely bad consequences, and the decisions to force people into these hardships must be justified and backed up by impeccable data. Pointing to, quote, experts doesn't give normal people much relief when the experts have been wrong time and time again. It is far past time to end this shutdown / lockdown. How much more data is needed before the North Carolina government admits they were wrong from the beginning? The quote experts were wrong from the beginning, repeated. The measures were taken were overblown. Hospitals are reporting that stroke patients in the emergency rooms are down 50%, and heart attack patients are down by 1/3. People did not stop having strokes and heart attacks. Food supply chains are being damaged. End of statement. Next one is from TJ Sawyer, Sawyer's Fun Park /AirU/EC Cats. And it reads, my name is TJ Sawyer, owner of soon-to-be Sawyer's Fun Park /AirU of Greenville and EC Cats. I was asked to send you a statement concerning our current state / county. So here's my official statement for this coming Monday's Board of Commissioners meeting. As a multi-business owner, we, that being my wife and I, feel that we've been discriminated against by this state government. Government is not in the business of picking winners and losers. It's not constitutional to allow some, quote, essential businesses to thrive while killing others. Define, quote, essential. Every business is essential because they provide a service or product that someone thinks is essential. It is not the governor's place to define that. Most business owners have been very patient in understanding. However, this has gone on long enough, and the new data coming out does not support this shutdown any longer, specifically in ENC or Eastern North Carolina. Thank you, TJ Sawyer. Next, we have Paul Hanna. Reads, I'm a senior citizen and member of the Aquaventure Aquatics campus in Winterville, where I exercise regularly. This facility provides an essential fitness service to Pitt County. I urge you to approve the proposed resolution regarding a reopening strategy coronavirus/COVID-19. Next one is from Trent Britt. It reads, Dear County Commissioners, I've been incredibly proud of the patience, adherence, and perseverance shown by all of us who have not been allowed to operate our businesses. We've all been following the data and the projected data. At this point, it is time to acknowledge that each county in each area of the state are being affected differently. The governor and others in Raleigh have absolutely no local knowledge of businesses in Pitt County. Every single solitary small business, regardless of the sector they are in, is an quote capital N of one. We are all uniquely different, but what we have in common is that we operate successfully only at the pleasure of the customer. They ultimately make the decision as to whether we succeed or not. If we aren't clean and safe, they won't come. This shutdown has already been a dramatic financial effect on all of us not able to operate. To allow it to continue puts many businesses at legitimate risk of not being able to recover. I urge you to unite and act on our behalf before the businesses become a reality. Read that again. I urge you to unite and act on behalf before that becomes a reality for any business here in Pitt County. I urge you to ask the governor for the ability to manage the reopening of local businesses locally. Thank you. Again, this is Trent and Gaynell Britt, owners of Next Level Training Center. Next is Nikki and Brooks Dixon. Pitt County Commissioners, my husband and I write this email out of concern for our family, Pitt County residents, and for small businesses. The original call to action was, quote, to flatten the curve, and numbers/science show we have successfully done that. As paid elected officials, what is your motive as to why the board is not pushing for a more transparent and, quote, Pitt County-centered approach, end quote, rather than continuing to, quote, move the goalpost along with the governor? Is the board willing to forfeit their paid wages for a commissioner to offset the lost tax revenue? The current proposed phases could easily take us into late July. It needs to be brought to your attention that Walmart, Target, Lowe's, all big box department stores having record sale quarters comparable to Black Friday are filled with hundreds of patrons each day. Yet churches, gyms, small businesses are deemed unsafe by the governor, and in turn, your silence appears to agree for enforcing these same restrictions. Why are we not seeing a larger spike in the numbers of employees who work in these areas if the numbers are, quote, so true? Our family asks you to please consider your current stance as a board and remember that each one of you were elected by Pitt County residents. Our families want to get back to work and expect you to make Pitt County your priority. Thank you, Nikki and Brooks Dixon. Next, we have an email from Tanner Spencer representing Spencer and Company Salon. Pitt County Commissioners, Greenville, North Carolina has been a wonderful place to raise my two boys and become a small business owner. My salon, Spencer and Company, celebrated its 10th anniversary on Sunday, May 3rd. For 10 years, we've provided safe services that meet or exceed the criteria for the State Board of Inspections. As hairdressers, we are continually aware of safety precautions and sterilization of equipment. Our services are not just essential for preferred physical appearance. Our services also impact overall positive mental health. A hairstylist is often portrayed as a personal therapist because of the relationship built with the clients over time. At Spencer & Company, we value the physical and emotional health of all of our clients and our coworkers. As directed by the City of Greenville and Governor Cooper, our salon closed at the end of March. As the threat of COVID-19 was uncertain, we understood the need to close for one more month as the city and the governor initially directed. We had met the original goal of being closed until April 29th. Due to low numbers of cases as well as the private design of my salon, we are asking permission to reopen. First, please consider the numbers of Pitt County as of May 3rd, 2020. Total population, 180,742. Number of cases, 129. Number of estimated recovery, 82. Number of deaths, 2. According to the Pitt County Health Department, both had several underlying health issues, referring to the 2 deaths. Second point, my salon is designed with separate rooms for each hairdresser. Each room has a chair with a shampoo bowl, as well as a separate chair for hair services. Each client is able to enter and have contact with only their personal hairdresser. Currently, salons are opening in other states, with much less protection between clients than what my salon offers by design. Before the stay-at-home order, we were taking extra precautions by allowing clients to wait in their car until their appointment, cleaning with disinfectants between appointments, and having only one client in the room at a time. We are prepared to take precautions in order to reopen. You ask that we shut down and shelter in place to flatten the curve. We have. You ask that we stay home except for essential items. We have. We are now asking that our ability to support our families be given back to us. I do not want to be forced into debt to survive. Let me be clear. My economic well-being is not more important than the health of others. However, I know that we can provide our services in a safe environment and have economic health without risking physical health and at the same rate as other businesses that have not closed at all. Restaurant employees have certainly been in close contact with each other every day of this pandemic. Grocery stores and hardware store employees have been in contact with numerous people every day of this pandemic. We are asking that our clients have the choice to have their appointment in a one-on-one atmosphere. We are asking for fair and logical solutions. We are asking to reopen our salon. We are asking the Pitt County Commissioners to petition the governor for local control and allow us to reopen our wonderful county. Thank you for your consideration. Tanner Spencer, owner of the Spencer and Company Salon. And then the last email submittal is from Lori Smith. This is from Crawford and Company, Hair and Nail Salon. My name is Lori Smith. My home address is 1077 Augusta Lane, and my hair salon of 11 years is Crawford and Company Hair Salon, which is located in Greenville at 1920 Smithwick Drive. I have worked there alongside with 6 other amazing women almost daily. I've worked through ailments, I've worked through storms and severe weather. I have even worked through pregnancy. I've worked since I was old enough to work. But on March 25th, 2020, Governor Roy Cooper told us we could not work, that we needed to stay home for our safety and the safety of others. He and other politicians told us that they were sorry and that they were there for us, that they were there to help us. I hear the news updates daily while I'm home with my children attempting to finish out their school year. I'm anxious each day the news briefings come on television. I am hopeful when I can call the unemployment agency. I am hopeful for the promised help and assistance of EDIL acronym and the PPP. But now my hope has been lost. Frustration and defeat have taken the place of my hope. Unemployment, ... denied, period. EDIL, ... no response, period. PPP, period. The PPP that I needed a quote relationship with my bank of 20 years. BB&T barely replied with email saying they wouldn't be there for me. Hairstylists are educated in depth about sanitizing and cleanliness. We practice these things daily. Our clients deserve a grade A salon, and that's what we give them. We can control the number of clients that enter our doors daily. We know how to properly sanitize between clients. These big stores that have remained open are not doing the things at all like it should be done. But here in America, where we have been told to stay home, small businesses don't have the freedom to interpret guidelines set forth by our leaders for the best interest of ourselves and our clients. Though our rent is due, though our utilities need to be paid, it seems that small businesses have been targeted during this pandemic. I always thought that Pitt County stood behind small businesses. At this point, it doesn't seem that way at all. Though our families suffer while we watch corporate America slumber through the social distancing guidelines, we do as we are told with our doors locked. In months to come, it will be so sad to drive around and see the businesses that have been forced to close their doors forever. Everything they have worked for. This is America. Americans were born to suffer through this type of oppression. We were born to rise above, to persevere. Americans are fighters, and we are too intelligent to just stay home. Allow small businesses to open their doors again. We deserve a chance to contribute to society the way we always have. There's no consistency with the current mandates. New York City and rural North Carolina cannot be treated the same. Let's get Pitt County back to work. Put small businesses, not just some, but all small businesses back to work and help America, the great country that it is once again. That's all we have.
Okay. Certainly, we'd like to thank all of the participants and those who voiced their opinion. And it has been duly noted. We will continue. Thank you very much. And now we should move on now to Dr. John Silvernail. This is going to be for report only. I do want to say that those of you county commissioners, that if you would write down your statements or questions that you might want to have for Dr. Silvernail when he finished. He's a busy gentleman. He's always on the move and trying to do a lot of things. So we want to respect what he has to do for the citizens of Pitt County. So please write your questions and your comments down that you might have for him after he finished. This is again for report only. Dr. Silvernail.
Good morning, Mr. Chairman, other members of the Board of Commissioners, and Pitt County residents watching in Cyberland. Want to review where we are with COVID-19 in Pitt County. We are now a little over 3 incubation cycles, or 6 weeks, since the first case of COVID-19 was identified in Pitt County. New confirmed cases continue to occur, but at a reasonable rate of about 2 to 4 per day. To date, only 2 residents of Pitt County have died from COVID-19. We've now had about 5 months of time to study COVID-19, where most infections, we've had decades or centuries to study COVID-19. Let's talk about novel infections in general, and I'll tell you where we are with this one now. You've seen this slide before. With novel infections, new infections like COVID-19, we have little or no experience treating the infection. Our experience continues to grow with this, and folks are doing better from a treatment standpoint every day. Limited diagnostic capabilities generally exist with novel infections, meaning there's a lack of an available test or limited availability of testing. Testing options and capacity continue to improve and have improved significantly. The acute test, the PCR test, is readily available with commercial labs. It's available with the state public health lab, and a number of other vendors. There are several antibody tests on the market, although one should be cautious with antibody tests because not all of those are equal. And there will very soon be what's called an antigen test on the market, which will allow for the detection of viral protein or viral antigens in the blood of an individual acutely infected with that, which will expand our ability to detect the acute infections. We talked about in the past about there being limited or no treatment options for the infections. There have been some treatment options that have emerged. It appears that the older drug hydroxychloroquine does seem to have activity against this. That is observational data. It's not perfect data, but it is enough that that's being used and used fairly widely. Desrosinovir, the Gilead product, has recently completed a clinical trial and shown efficacy against the virus as well, so that is available. In general, there are limited options for vaccine for these infections. There are several groups working on a vaccine for this infection, and there's hope that that may hit clinical trials by the summer and be available in early 2021. Wanted to remind you that when these things appear, we see the sickest people first. We see the deaths, we see the hospitalizations. We eventually see the folks that are sick enough to seek medical care, but not sick enough to be hospitalized. And then there's a whole bunch of folks that are below the waterline of that pyramid coming out of the water, who are asymptomatic or mildly symptomatic. And we just don't know how big the base is, which means we don't know how big the denominator is for calculating rates with this infection. We suspect that that base is much broader than we think. Some studies now estimate that at 5 to 9 or 5 to 10 times the number of confirmed cases in a given community. Work is underway to understand how big the base of that pyramid is, or how big the denominator is, so that we can more accurately calculate rates for this infection. This is a slide I showed in our press conference last week. Generally, it's represented as a triangle, but in order to understand how we get infections or get disease in an individual or a population, there has to be an interaction between the pathogen, meaning COVID-19, the host, meaning a person, and the environment. For COVID-19, the pathogen largely seems unchanged at this point. There have been some stories of a second strain out there. I have not seen that in a reputable scientific journal or press. Host factors, age, and underlying conditions are largely responsible for the more severe outcomes of this infection in individuals. And the environment is what significantly affects transmission. And by environment, the thing that probably is most tied to transmission is population density. One of the things that we have on our side here in Pitt County and across Eastern North Carolina is a relatively low population density in comparison to other parts of the country. I'll show you our data. I'm going to show you the Pitt County data, and then I'll compare that to the state data for you. We've tried to model our data presentation based on what the state has presented. Guidance on this has been somewhat lacking or unclear, coming down to us at the local level. This is a look at our COVID-19 cases by date of specimen collected. And you can see on our busiest days, we've had a couple of days where we've hit 7, a few days where we've hit 5, but most of our days have been between 1 and 4 across the county. This is current as of the 29th in order to be prepared for the presentation this morning. This is the chart from the state data. And again, you can see that across the state, we've had some days where we've had in the 500 and change range of cases. The last date that was reported when this was pulled was 47 for that day. I believe over the weekend, the state had just over 120 cases on Saturday or Sunday. So their data has slowed as well. This is our cumulative case curve, again, by date of specimen collection. So you can see that there's a fairly steady rise, and this will always go up as a cumulative count. But I think if you look at that red line, you can see that this is sort of flattening out and starting to shoulder out. And when this was prepared using Friday's available data, we were at 122 cases at that time. And our numbers were slowing in terms of the number accumulating, so kind of shouldering or flattening off there. This is the state's cumulative case count, again, by date of specimen collection. And the same thing, if you follow that, you can see that there's a steady rise, and then this curve seems to shoulder out or flatten out, still increasing, but increasing at a much more gentle slope or a much decreased slope of rise. This is calculated percent positive of our total testing available on a given day. So what I do is I take the total number of results that are available for the day and calculate the percentage of positive and negative returns for that day. And there were a couple of days that predated March 30th where we were less than 18. We went from 13 to 15 to 18. So there was a fairly steep ramp up. And then we stayed in that 18 to 20 range from March 30th till about the second week of April. And then we began a decline. On April 20th, we had dropped from, or April 16th, excuse me, to 18.4. And we've gone down steadily every day since then. And now we're at about 9.4% as of Friday, as a percentage positive of total testing done. So meaning the number of cases returning positive has decreased as our testing volume has increased. This is a similar curve showing the state data, and the state data seems to show a similar kind of curve. They had a couple of days where percent positive peaked at 17% in their curve. Overall, across the state, they're down to 7% positive as a rate of returned testing. And then last but not least, this is a bar graph comparison of total testing versus negatives in the green column versus positive tests at 122 and deaths as that blue line at 2 deaths across the county as of Friday when this was prepared. So I didn't realize this was a report only. I had planned to take some questions, but if there's no questions from your perspective, Mr. Chairman, then I thank you for your attention. And
Yeah,
Mr. Chairman, I think there are commissioners who had some questions for him, if that would be allowed.
yeah, I think they have some questions, but they're going to be trying to keep it at minimum. I do want to say to you, Dr. Silvernail, you've been on it out there in the community and certainly working hard for the citizens of Pitt County. And I know that our situation is a little different from other parts of North Carolina in terms of what we've been doing. We've been practicing the social distancing. We've been practicing not gathering large crowds, practicing washing their hands and wearing masks. Do you contribute that to some of the reduction in the cases that we've had here in North Carolina and Pitt County? And then if we didn't do that, in your opinion, where do you think we might be now?
I do think the actions that the county has taken has put us in a good place. I feel like we are in a good place at this point. I don't speak for the hospital, but the hospital here in Greenville's had a relatively flat census of COVID-19 patients. Our caseload never really saw that exponential growth that we talked about, where it would be doubling every day or every 2 days. We had a fairly gentle rise and now sort of plateaued off. So I think those interventions definitely helped protect our community. And I think bless you. I think we're at a point where, yes, those could be lifted if the governor's order were not in place and we could begin some sort of structured reopening of things.
Great. Okay, Madam Clerk, if you would go down the list and ask commissioners.
Okay, I think Commissioner Nunley is the only one as of right now that has his
Commissioner Nunley,
hand raised.
okay.
Thank you, Dr. Silvernail. Just wanted to follow up on a couple of points. And we've been hearing from the CDC and the North Carolina Department of Health and Human Services and from your office in coordination with them that there are really three primary benchmarks, 3 or 4 depending on how you talk about it, but that public health officials are really advising that we follow as we start to slowly open up the economy. And I wondered if we could just kind of go through each of those to see where Pitt County falls. Clearly, there may be some disagreement whether or not there needs to be local or statewide approach for releasing them, but I'd like to get a sense about where we sit in Pitt County with regards to how those benchmarks are met. And I think the first one that we hear Dr. Anthony Fauci speak of and the White House speak about is really this idea that we see a sustained flattening or reduction of cases for a 14-day period. How are we faring, at least locally here in Pitt County, on that metric?
I think we've been, if I can back up, Commissioner, if you go back to our case count bar, we've been pretty steady for probably more than 2 weeks. We've had a couple of days where we've had some spikes in our reported cases, but in general, we've been in that 2 to 4 range for more than a couple of weeks with a nice, slow, steady burn. I know Dr. Waldron characterized this as a category 5 and wanting to cut it down to a category 2. I'm an old fireman, so for me, instead of this being, a roaring blaze, we need to have it be more of a steady burn or a slow burn, kind of a smoldering fire. We know the cases are going to continue to occur, but we want those cases to occur at a rate that will not overwhelm our healthcare system or cripple other vital services. And I think at 2 to 4 cases a day that we probably have that rate of slow burn that we need to move forward.
So you say that we're good right now on capacity, and we were seeing that reduction of active caseload in the community.
Yeah, I did not show recovered in the slides this morning. That's a calculated number, an estimated number. And as of Friday, we had 82 out of 122. So that would give us a 40 active cases as of Friday as an estimate in the county, confirmed cases.
And with regards to testing and tracing, I think that there's been an effort to ramp up testing. You've indicated that we've had higher capacity and more testing as those percentages start to come down, which is really good news, thanks to you and Vidant and the other healthcare providers that are getting those numbers lower and lower and lower. So would it also look like in Pitt County that we are in a place that we have sufficient testing capacity in the event that we have spikes of infection that potentially could come after we start to reopen? Do we have sufficient surveillance and testing capacity to cover spikes and also test and trace so we can cordon off any spikes that we see within our communities?
Yes, Commissioner, I think the commercial labs have the capacity now where our turnaround time with those is 2 to 3 days. The state lab is about 48 hours. Again, I don't speak for Vidant. Their rapid testing platform is available, and they are running an increased number of tests on their rapid testing platform. The antigen tests, they have been predicted to be available in the next 2 to 3 weeks. How soon that'll filter down to us is another story, but the FDA approval was estimated to be about 2 to 3 weeks out on those tests, which would further increase the ability to detect the acute infection. As far as contact tracing, the good news is that our residents here have really gotten the quarantine, the self-isolation. You've heard me say before, sometimes we've had the contacts of the contacts of the contact isolated or quarantined. So people have really done a good job with that. In general, our contact traces with local residents have been relatively short. It's been their immediate family group, perhaps a person or two outside of their household. What we have started to see in the last week or so are some little clusters that generally are family clusters where one person in the family gets it and other individuals are either sick or tested and show that they have the infection. We have not seen these very long strings of infection with this or long contact traces with this. So most of our contact traces have been fairly short. And I do think that we, in the health department, we have 2 folks that are generally dedicated to that sort of work, not only for COVID, but they also do our other infectious disease tracing, non-STI tracing. And then we have several folks that are involved with STIs that do that sort of contact tracing. And if we needed to, we could move some of those to COVID-19 tracing if the volume got to be where we needed to do that. There also is the State Contact Tracing Collaborative, which they just rolled out on Friday. Still many details to be determined, but there will be staff available to local health departments if they need it through the Carolina Contact Tracing Collaborative that the state is building between the AHEX and Community Care of North Carolina, CCNC.
So our tracing, thankfully, we've been able to manage it due in large part because folks have been abiding by the stay-at-home orders, and so it's cutting it off. Presumably, as we reopen, we're going to need a little bit extra capacity to trace and cordon off, and you feel confident that we have those resources, that you have the resources you need as we start to slowly open the valve, and infections will clearly go up, but we'll be able to manage and cordon off and contain those folks as those streams get a little bit longer. You feel confident of that?
I believe we will be able to do that, yes.
Okay. Good. And final question, have you communicated to the Department of Health and Human Services? I mean, you may have already, but this just for public knowledge and also for the commissioners. Have you communicated with the Department of Health and Human Services, State of North Carolina, Mandy Cohen, and let them know that the benchmarks that we're all looking for, that that things are looking good here in Pitt County? Just let them know where we currently sit as they're making their decision on when all the collective counties can safely start to move into phase 1 reopening, And have you gotten any feedback from the state on when we might expect to see something along those lines?
I'm on a call every Monday with what the state calls the large or high impacted counties. I have shared our numbers with them. I have not received much feedback from the state on that.
Okay, thank you.
You're welcome.
Thank you, Commissioner Nunley. I see Commissioner White, Commissioner Ward, and Commissioner Coulson. Commissioner White.
Thank you for your presentation, Dr. Silvernail. I was taking notes, so just to be sure that I was writing things down correctly. Pitt County is at over 3 incubation cycles. Our new confirmed cases are at a reasonable rate. The death toll is still at 2. We do not have any more than 2 deaths. Our testing options and capacity have improved significantly. We've been at a steady rate for more than 2 weeks. Some new treatment options have emerged and research is progressing on a possible vaccine. And you said that there is no reason to believe that there will be a second strain from any reputable source. And most days our case count is in between 1 and 4. Is that correct?
That is correct.
All right, thank you.
Thank you, Commissioner White. Commissioner Ward.
Yes, thank you very much. First thing I want to say is thank you to Pitt County Health for the job that you all have done and the steady reporting to our county. And I was wondering about the report on the cases have been just for Pitt County, but we have, I forget, is it 5 or 6 VITA hospitals in the eastern part of North Carolina? Do we have a report from those hospitals on any cases or what the report is kind of for the East?
I do see that data, Commissioner. Again, I stress I do not speak for Vidant Health. The census across the Vidant system has been in the 40s and has been steady there probably for a week or week and a half, maybe pushing 2 weeks in their census data. They have seen a gradual increase in the number of hospitalizations, but it has been manageable. That 40 number is spread across their system.
40 cases.
For in the 40s, yeah, it varies from day to day, but they have been, the last week they crept up a little bit. They've been between 42, 43 cases and maybe pushing 48 or 49 casing on the high days.
Okay, one other question, and this will be an opinion, and if you don't want to answer it, that'll be okay. But I was wondering what it would be like if we are here on Monday, and we've got like a full week, 7 days, and this Monday till whenever the starting date is in your weeks, as far as being shut down. Is there a way that we could come back and visit this, say in 4 or 5 days, or say 5 days, when we could have really good data on some of the things that are going on? Not that the data you're sharing with us is not good, but some of the questions that some of us may have about other areas in the East. And because we have a lot of people from the East coming into our hospitals and coming into our stores and to deal with our merchants and everything from all over East and North Carolina. So is there, would that help? And then maybe we come back as commissioners and revisit and consider, just giving this next 5 or 6 days to kind of figure all of that out, so we won't just say open tomorrow.
Our plan would be to update these on a daily basis, so that you'll see the case counts every day. You'll see that percentage every day. Our cumulative case count will go. We've been working on how to present that recovered case count, and that might be best done as a bar graph from when we started calculating it as well, so that you can see that But right now we're at about 3/4. If you looked at 80 out of 182 out of 120, we're about 3/4 of the cases we would estimate have recovered or at least met the time frame to have cleared the virus from their system. There's no agreed upon definition of recovery, but if we look at when they're likely to be free of the virus, that's the number we would estimate for those that have been tested. So yes, we will publish these, update these on a daily basis. They'll be on our coronavirus webpage and available to you. If you would like us to circulate those directly to the commissioners, we can certainly do that, and so that you can see the data each day going forward.
And could that include the cases in our hospitals in the East, what I call the bottom hospitals? Because I
Yeah, I
don't
would need
think
to-
all of them are taking in the cases, are they?
Yeah, I would need to get permission from Vidant to release their data. And I can ask about being able to share that with you. But it's not my data to share per se. So I have to be careful about what I release. And again, I don't speak for the hospital. I do have consulting privileges at the medical center. I am part of the medical center's infection control committee, but I don't speak for the hospital.
Sure, but if I would be, as one commissioner, asking you to contact Dr. Waldron and see if we can get a clearer picture of the East. Thank you.
You're welcome.
Okay, thank you, Commissioner Ward. Commissioner Coulson?
Back when we first made the decision to go into, a shutdown, you came to us and you mentioned in your report that there was going to be an exponential potential increase. At that time, we were hearing it was going to double every 3 days. My background in quality and engineering and mathematics, I did a real quick in my head iteration of that. We had 4 cases at that time. In 30 days, we would have gone through 10 iterations. That meant that today, or not today, at the end of that period of 4 weeks or a month, we should have had 4,000 cases. Today, we should be having 16,000 cases. Although we have been doing social distancing and so on, it would appear to me that just that social distancing did not stop that. In other words, my point being is that the exponential increases that were feared did not materialize. They've never materialized, and they probably never would have gotten bad even if we practiced no social distancing, as what that iteration theory would have allowed. So when we voted for this, I voted for it for one reason. It was local control. Now, Commissioner Ward, you're talking about the East, and I care about the East, but I care about Pitt County more than the other 99 counties. They need to be taken into account. But what I'm afraid of, Dr. Silvernail, is that we're going to make all kinds of excuses to keep on holding businesses closed, and there's no indication as to what the governor's going to do. I mean, 2 weeks ago, his plan was to get a plan, which was no plan at all. And quite frankly, I'm frustrated that I'm getting bombarded with a lot of sensible people telling me that we made a mistake. And I think we did. I think we overreacted. I think we're still overreacting. And that it is now time to open up the government, the economy. If we collapse this economy by trying to be perfectly safe, and we go into a depression, it'll be worse than the last depression. I encourage everybody that has never done it to read the book The Grapes of Wrath by Steinbeck. It's a very, very heart aching book as to what the depression did. We can't afford to allow our country go into that and do this, what we did back in the 1930s all over again. So, I mean, I'm glad to hear you're saying essentially that we need to do something that we would be able to open up the government. And I think that message needs to be sent, and sent clearly and sent now. We're getting ready to have a discussion about a resolution. And we need to have a resolution sent to the governor asking Pitt County to be exempted from his executive orders. More a statement than a question. That's all.
Thank you, Commissioner Coulson. We now have Commissioner Albright.
Am I being heard?
Yes.
Yes.
Okay, thank you. I'm getting a muted sign, but thank you again. I believe that Dr. Silvernail, you said, and I want to make sure I got this right, that if it were not for the governor's order, you would be comfortable with some, the governor's order for us to stay in place, that you would be comfortable with some opening up.
Well, we're subject to the governor's order. If you're asking me, would it be safe to have a progressive reopening? I would say yes. But we are subject to the governor's order as I understand the law on this.
And this is something that you would report during your Monday conversation with state officials?
Mm-hmm.
Yeah, and that makes me think that Commissioner Ward's idea of meeting again real soon is kind of interesting, that we hear a report back from you about what the state says. Or do you know, are we aware of any counties that have been allowed to supersede the governor's order, or that is to take back local control?
No one's been allowed to. Gaston County did try this, and from what I heard on the news this morning, that has been somewhat of a disaster with mixed enforcement, mixed messages.
That's a fear of mine, is the enforcement. We have all, I think, gotten some interesting communications from one business over the weekend. I think that you were back in reply to, and this business had done a lot of extra efforts to try to get open, and I thought made a really good, strong case for that. And I believe that you were indicating that they had done what they needed to do. And that's another one that I hope that you would carry forward to the state officials when you're talking, and again, in this argument, that we'd be allowed to identify businesses that are able to reopen.
Individual businesses can apply to the state, and I'm not sure what that office is, to be reclassified as essential. And some businesses have done that and been successful.
I understand that that's happened in Wilson County, and that at least one spa has been allowed to reopen. Would that be some information that we could, how to contact that office, that we could get up on our COVID-19 webpage? What is that state office, and how does a local business contact them? I believe the Wilson case, as it was reported, happened very quickly, and that is that the spa was allowed to reopen within about a week of their appeal to the governor's order.
Yeah. Wilson's actually had more activity than we have too.
Right, yes, they have, and that's what I'm hoping, that we can get this information out. I was surprised to see that. I think that those are my questions right now. Thank you again.
You're welcome.
Thank you, Commissioner Albright. Commissioner Perkins Williams.
Thank you, Mr. Chairman. Dr. Silvernail, thank you so much for what you've done and what you continue to do for this county. I appreciate your personal interest and work into this. When we voted to send the message to our residents to go home and stay home, I voted in favor of it because I know we needed to have proactive measures and activity. Since that time, after that, I started receiving, since some of my members of my household are in medicine, I kept getting the message and the count. So I started monitoring the state statistics on the dashboard early in the process of go home and stay home. And when I look at the statistics, not only do I look at Pitt County, I look at the neighboring counties because I know that the counties right around us come here, as Ms. Ward say, to do business. Not only go see the doctors, but they also shop while they're here and do other things while they're here because we do have a number of stores. And that too monitored. So I started keeping a log. I printed out me a calendar log, and I started keeping a log of those counties adjacent to us who can just step outdoors almost to say, or throw a rock and be in our county. So I know that you've said that the statistics are going down, but I asked a question early in our actions. Do you test everyone? And the response, I believe, was that you do not test everyone, that you test the people who meet the criteria of the three major symptoms. One being temperature, high temperature, 100 or more, a dry cough, and the third being a hard time breathing. And I know sinus and all kinds of common illnesses exist here. So I started monitoring that. And now I do believe we are testing more widely. Is that correct?
Yes, it is, ma'am.
Okay, but you're still not testing everyone who think they need to be tested. Is that correct?
Well, me personally, no. The health department personally, no. The testing guidance has now changed again,
Mhm.
and any licensed healthcare provider can test any patient that they have a suspicion of having COVID. So last week, the CDC expanded the number of symptoms that they
Yes.
felt were consistent with COVID-19. And any licensed healthcare provider, a physician, nurse practitioner, physician's assistant can order COVID-19 test on any patient they suspect of as being COVID-19 positive.
Now, their results go to the governor or go to the North Carolina Department of Health and Human Services statistics as well.
They would, yes.
Okay, that's what I was thinking. I watched the statistic grow and ours are still climbing. And what concerns me is that because of the argument, both on national news and some local goobly gop, I call it, when they're just rumor mills or talk or conversations, the personal protective equipment has not changed that much. And so the Department of Health and Human Services for the state of North Carolina has also increased their reporting messages to include the PPE statistics. And there are more requested because of the people who are in my immediate family work in medicine. They talk about those protective gears for the PPE. And I looked at those statistics and they order more than necessary. And it was explained to me that whenever they leave one patient, they must, if they're going to do it in a communicable case, they shed all of their gear. They take it off. And then before they go into the next patient, they have to put on new gear. The orders in this report shows that the amount of orders that they have requested exceed the amount provided. They asked for and they received the mask and everything, but the gowns they've not. They have asked for far more gowns than they did receive, and they have received far more gloves, and everybody can get gloves here and there, than they have requested. But when you look at the coverall and the face shields and all of that, that is way down. that means that you and those in your kind of position, the ones who are in close access to the virus, are not as protected as you feel medically that you should. And those people who are not protected, when you leave and go home, you concerned about taking it home with you and your family. And once it get home, you can't control where your wife go out and shop at or whatever, and where the children go. So that increases the amount of probability. Now I value Commissioner Coulson's mathematical ability. And I'll tell you, I don't have that kind of quick math in my head, but give me a piece of pencil and a calculator, I can do a little bit better than I do in my head. And I think we are cautious. And I received a lot of emails, and thanks to Kimberly Hines and Jana, who have sent that information to us. There has been one business who's sent a plan out to how they're gonna, if they are allowed to open. And it seems to me that their customers sent the email, which business look at dollars and cents and how much they make. The customer look at their value to them. And these weigh with me. That, what is it? I got it close by here. Aqua Venture, I think it is. Aqua Venture is a therapeutic. Their customers said how valuable it was for their health and welfare and body. And Aqua Therapeutic, I guess home office was somewhere out, and that didn't weigh as much to me as the local folks sent out their message. And it was an excellent plan as to how they're going to go about handling their customers, how they're going to, when they were going to give it protection and that sort of thing. That weighed with me. So I know that the governor is going to raise it. He's looking at it again on May 8th, I understand, which is next week, May 8th. I'm inclined to think maybe we can, no, I'm not waiting to answer this, because I know not everybody paid attention to it. Not everyone followed it. I do go to the grocery store when I just feel like I have to have a special flour to make a biscuit. But and then I stop at the post office at a time when I know there are not many people going to the post office. And then my children are worried about my contact. And I got this long medical thing from one of my children that tells me what I should and should not do when I go out. So I get bossed around, and I put up some resistance, but they went out because common sense makes a difference. Here, what I'm trying to say is, not everyone follow it. Not everyone go by it, and you know that as well. And that sandbar before the river rose stayed full of people when it was pretty. And I do know that there are a lot of people who stand in group in close proximity. And I'm giving you all the things I've noticed so you'll know what I look at to weigh my decision. I know you all are patient and all of that, but cases are based on the fact of your testing, and because that's a physical statistics and something that I can view and look at. And our cases are still going up. And the counties around us are jumping faster than ours. And yes, Wilson was ahead of us to begin with, and it's still jumping, and they have more deaths than we do. And that's good that we don't have as many, but a lot of counties around us don't have the capability that we have here, because we are the medical capital in Eastern North Carolina because of what we have here for East Carolina University. So I think I take all of that in consideration. So if the other counties don't have the access we have, and you do test a little more, but you're still not testing everybody, is that correct?
No, there's no way to test everybody, ma'am.
Okay, everyone, I'm not just everybody, but everyone who feels like they may need a test, because it's hard to distinguish between sinus and some of the normal illnesses. And that, do you test you test a larger group, don't you?
Well, the guidance has been expanded, and
Yeah.
someone who was coming in with a sore throat or nasal symptoms could now be tested under the current guidance. Even if there was the potential that that was allergies, they could still be tested to rule out the COVID in that situation.
Well, that would give a higher number if you locate it in the county, but you test more, because I noticed that your testing is going up. What I'm saying is, when you test more, you're going to find more. And I think if
Correct.
we stay with the governor's thing of staying a little longer, and a business like Aqua Venture, I would vote for, if we were voting on a case by case, and we don't want to get into that. I would go with Aqua Venture. They have a very good plan for opening, and some places like Lowe's, I guess they gave us something to do, because my son said they know I like Lowe's. Don't go to Lowe's. It's crowded and it's packed, and it has been for the whole time. So I'm leaning towards sticking with the governors, and then revisiting. I'm with Beth as far as revisiting it in the future. And I know that was a long time to say, but I want the residents to know where my vote will go for them, because I vote with their input and I vote with their feelings, and I look at what we are faced with. We don't want a tsunami. We don't want an earthquake, and we don't want the worst to occur. So I appreciate your caution, Dr. Siboney. Thank you.
You're welcome.
Okay, I think all the commissioners have spoken that needed to speak. Well, I do see Commissioner White for the final statement, question or comment. Commissioner White.
Yes, sir. The whole point of the original shutdown order was to slow the virus down, not to eradicate it. Only God can eradicate a virus. We're just humans. So we have accomplished what the original order was for, to slow the virus down. Dr. Silvernail said that it had plateaued. We can't stop the virus. I would also like to bring up that the hospital has made pay cuts and has furloughed employees because their patient volume is down. Physicians East has furloughed half of their employees because their patient volume is down. Simple procedures such as stents have been put off. My great uncle needs a procedure on his heart to lengthen his life, and that's been put off. Don't know if he'll be able to get it. That's all I have to say right now, except for, is it okay if I ask Janice a question right now?
Can you ask Janice a question? Commissioner White's asking if she can ask the county attorney a question.
Yes.
Madam Attorney, when Governor Cooper initiated the stay home order, it was against the Council of State. Is that even constitutional or legal?
So I am not prepared at this point to provide an opinion on that particular conflict between a council of state and the governor. I can say that the order that we have from the governor now has been enacted during the state of emergency and must be abided by all jurisdictions until there's further notice or determination on that. I don't have an opinion one way or the other about that.
Okay, thank you, Madam Attorney, and thank you again, Dr. Silvernail.
Okay. Thank you very much for all of the questions and comments. Commissioner Floyd Huggins, is that, do I see your hand? Yeah, Commissioner Floyd Huggins. She would be the last.
Yes, thank you, Mr. Chairman. Dr. Silvernail, I want to thank you as well for what you are doing, along with all the other commissioners for what you are doing here in Pitt County. I thank you that you have you've told us that we are in a good place, and I am really pleased that we're in that good place. And I feel like that we're in that good place because we took action when you and Mr. Walton came before us. So I don't think that when we when we take action to save lives that we overreact. Because I am really concerned that, yes, we're doing more testing, but we still are not testing enough. So I wonder also when a positive test comes back within a family, if and you're making that contact to trace this, do you find at any time when a family member that tested positive and the other members of the family don't go and get tests?
We've seen some situations, yes, where one family member is tested and the others aren't. Interestingly, we've seen some family groups where there's what we would call an index case, meaning the first family member who is tested and test positive, and other family members also test positive. We've also seen several times where the index case in a family happens and the family members don't test positive, even living in the same household. So even within a household, sometimes people do a better job keeping their germs to themselves than in other places. There may also be some of us that have a little more resistance to the virus than others. Again, it's a very new infection, something we have limited experience with. And as I said, our experience is growing, but there's still much to learn about this infection and the intricacies of its transmission amongst us.
But I don't know whether or not you answered my question or not, whether or not I heard it. So if one person in the family tests positive and there are some that don't get tested, that's my question. Have you found that to be true?
Yes, because that generally would fall to their treating provider to determine if they're to be tested or not. We have done some contact investigations. Up until about a week ago, the guidance was that if they were asymptomatic, to not test them. So we follow the state and the national guidance on that.
Okay. Well, in your opinion, from what you are telling us, is that if we continue on the path that we are on now, and decide to look at this, say another week or another 2 weeks, where do you think we would we be better off in following that path?
Well, I think based on what we've seen so far, I think our rate of new cases is going to remain in that 1 to 4 per day. We are in the process of doing more testing in the county, so that number may go up some. That's why we also want to look at it as a percentage, as a rate of positivity. Right now, we're seeing about 1 in 10 people tested are actually positive when they're tested. So that's a good number. If the number goes up and we tested 100, doubled what we were doing now, but we still found the rate was 1 in 10, that would, our case count would go up, but our rate of positivity would stay the same. So that would be a good thing.
And as Mary said, we have counties that surround us, and those citizens come to the doctor, to shop and whatever here in Pitt County. I know our first priority is Pitt County, but we also have to be concerned with people coming into our county, maybe bringing the virus in when we open up all of these businesses. So I'm really concerned about that. I know that we cannot wait to have a perfect situation, no cases, but I would hope that we will continue to test more to make sure that we are reaching some of those citizens who are, I would say, are more more apt to get the virus. So I would like to know, again, I guess I'm still thinking that we should continue to pursue what we are doing now for another couple of weeks, and then look at it and see about easing, and maybe I don't know if it will coincide with what the governor said. I know Chris asked you if you were in communication with the state. So I hope that we can all come to a decision on how we're going to reopen Pitt County, as well as our neighboring counties too, be looking at. So thank you again for all the information that you continue to provide to us as commissioners and to the citizens of Pitt County.
You're welcome, madam.
Thank you, Mr. Chairman.
Thank you very much, Dr. Silvernail, for the information. I know you're busy, so again, thank you, and keep up the good work.
Thank you, sir.
Yes, sir. Thank you. Now we have a manager report, Scott Elliott.
Thank you, Mr. Chairman. A few things to report. On your next meeting dates, we have May the 18th will be your next regular meeting. That will again be a Zoom meeting like we're having today in terms of the meeting format. Then after that, on June the 1st, we are asking the board to meet in person at the Agriculture Extension Center. We will utilize appropriate social distancing as needed for that meeting. That meeting will be a regular meeting, but will also be the budget presentation for fiscal year 2021. And then the following days on item B for Tuesday, Wednesday, Thursday, June the 2nd, 3rd, and 4th will be at the Ag Center 8 to 12 to do the budget workshops. Now, if things change with the governor's phase 1 plan that would allow us to meet here in the commissioner's meeting room, we would make you aware of that, and we'd plan accordingly with that. Please keep in mind that our whole budget process has been pushed back a month. We've actually have a budget prepared and balanced, but preliminary balanced. But we are wanting more time as we to see what's coming down from the federal government, the state government in terms of COVID relief, whether for general revenues or our COVID expenses. So by pushing it back from May to June, this allows us time to respond and to better be prepared for those budget workshops. Also, we have budget workshops for an additional week. We always do 2 weeks, but we normally have traditionally gone 1 week, but June 8th through 12th would be a tentative additional workshop dates if needed. On item C, I had brought up in your last regular meeting 2 weeks ago, wanting to bring back the strategic planning consultant contract and put it on this agenda, and have proposed a way to pay for that. In talking to management team and as a group, we think it probably would be best just to delay this whole process for right now. One of the major reasons is because we would like to have a high level of public engagement and input into this process. And with the current COVID restrictions, that would be hard to do. So my recommendation would be just to delay that for the time being, maybe bring it back later in the year. I have one other item to, well, 2 items to bring to you. One kind of is related to COVID-19, and Walmart has decided to open a testing site here in Pitt County in Greenville. They've done this in several locations across the United States, and we've been talking to them for probably the past week, 2 weeks, informally trying to nail down what their plans are, where the location and so forth would be. So we've got a community letter that we have received from them this weekend. Mr. Chairman, if I can, I just want to read this.
Okay.
This kind of gives an introduction of what it is, and talks about the what, the who, the when, the where, what to bring and what to note. And then in terms of the results from people who take advantage of this, where they will be able to find those results. I do want to say that we're going to post this on the Pitt County webpage for the coronavirus. So this, what I will be reading, will be there as well. So the public is welcome to reference that page. So this Walmart testing site for COVID-19 Again, as a testing site, it will be at the location at 210 Greenville Boulevard here in Greenville, North Carolina. Their statement reads, at a time when COVID-19 testing is critical to the pandemic response, we want you to know there is a drive-through testing site available to anyone who may be exhibiting symptoms of the virus. In addition, the site is available to all healthcare providers and first responders, whether or not they're exhibiting symptoms. We know that they are on the front lines of this pandemic and may be exposed to COVID-19 while keeping our communities healthy and safe. We are grateful and humbled by their efforts during this unprecedented time. Please find information below regarding the testing site and how to schedule an appointment. So first, the what. The what says a drive-through COVID testing site has been located in the parking lot of the Walmart Supercenter, 210 Greenville Boulevard, Greenville, North Carolina, to test all healthcare providers and first responders and anyone who is exhibiting symptoms of COVID-19 at no cost to the individual. All appointments will be drive-through observed, self-collection in the Walmart parking lot. To be tested, individuals must schedule an appointment through eTrueNorth at www.doineedacovid19test.com. Do I need, just like it sounds, do I need a COVID-19 test.com, which will screen the individuals to ensure they meet CDC eligibility for testing. If individuals have difficulty scheduling an appointment, they're to call 800-635-8611. Again, that's 800-635-8611. Says the testing site is supported by Walmart, and eTrueNorth and state and local officials. In terms of the who, again, their who is all responders and healthcare providers and anyone who is exhibiting symptoms of COVID-19. For more information on testing eligibility, please see CDC guidelines. I give a reference here. I'll read it out. https:// www.cdc.gov/coronavirus/2019-NC-CoV/downloads/priority-testing-patients.pdf. In terms of the when of this testing opportunity, the drive-through site will be open Mondays, Wednesdays, and Fridays weekly, 7 a.m. to 9 a.m., weather permitting. Please arrive no more than 10 minutes before your scheduled appointment. In terms of the where, it says you must first qualify for COVID-19 screening and testing at the Do I Need a COVID-19 Test.com site I referenced. There's also a QR code that will be on the website that you can pull up if you'd like to use the QR code. Again, the Walmart parking lot. Says, please note, testing is not available inside any Walmart store. In terms of what to bring, says the testing site will require an appointment, again, through the eTrueNorth online site, that Do I Need a COVID-19 Test.com. Says you will receive an appointment confirmation that you will need to have on hand when you arrive on site. In addition, please make sure you bring a valid photo ID for proof of identity. Those being tested will need to wear a mask and stay in their cars for verification of eligibility criteria, ID check, and sample self-collection. For the safety of those on site, the test site is not able to service those who walk up. Individuals tested will perform a self-administered nasal swab in their car with the health provider observing them. Directions will be provided in the confirmation email after scheduling the appointment and on site. If you don't believe you will be able to administer the nasal swab, please bring someone with you who can assist you. It is important to take care of yourself and monitor your symptoms closely. If symptoms do not improve or you develop new or worsening symptoms, seek medical attention right away. Do not wait to receive your results. And in terms of the results, this last part here, individual will be able to access the results on the Do I Need a COVID-19 Test.com site. They will receive a text and or email notification when their COVID-19 test results are available. Average turnaround time is approximately 3 to 5 days from the day of collection. So while individuals who are tested or awaiting test results, please follow CDC guidelines and take steps to prevent the disease from spreading to people in your home or community. It says if you're having questions regarding your scheduled appointment, please call 800-635-8611. Again, we will post this on the Pitt County Coronavirus website as a point of reference. So that is, my understanding is that is up and operational as of today. They actually set up this past weekend, and that is what Walmart has shared with us. Mr. Chairman.
Good news. Good news. I think that's certainly that people have been wanting to hear here in Pitt County. So that's very good news. I see two hands, Commissioner Coulson, Commissioner Floyd Huggins, and Commissioner Albright. Just wait, just put a button. Commissioner Coulson.
I just want to go on record to say the strategic planning consultant. I think we need to develop an internal, I'll call him an expert in that. I've been involved with several strategic planning efforts, and I don't think we need to spend $80,000 on a consultant. Anyway, that's all. Thank you.
Thank you, Commissioner Huggins.
My question is to the county manager about the Walmart. Do you know how long this will, how long they will do this? A week, 2 weeks, or a month? Or how long?
They had initially indicated through the end of May, but this has been kind of a moving target with them in terms of the who, what, when, where, and how. We'll try to nail that down. But again, it was a couple of weeks to the end of May, so we'll try to get you an answer on that.
All right, thank you.
Commissioner Albright.
Yeah, a quick question for Mr. Elliott. When the tests are being administered at Walmart, I'm assuming that those results will come to our county. I'm just curious about the I'm getting some kind of message here about the timetable. How long would it be before those results that are being done every Monday, Wednesday, and Friday at Walmart? How long would it be before we know those results?
I'd ask Dr. Silvernail to come back up just to verify what I'm saying is correct. But if there are positive results, they would have to be reported, as I understand, just as any other, whether Vidant or any other private practice would have a positive result, would report those up.
Yeah, as you said, the turnaround is 3 to 5 days. Those will be reported to state health first, and then they will forward it to the county.
Thank you. Thank you.
Okay, very good. Thank you very much.
Chairman, had one other item. Just want to point out on your items for consent, we had one item on there that is a donation to the Pitt County Animal Shelter. Is a $10,000 donation through the estate of an individual. And just wanted to let you know, we will send out a thank you to the estate on that. This person had no contact with the animal shelter. They were not a volunteer for the shelter or anybody that we knew, and did not ask for any type of special recognition, but did want to just point that out. There's several questions and agenda preview on that.
Great. Okay.
That's it.
Okay.
Sorry.
Item for consent. Could we get a motion and a second for that? Commissioner Huggins, a motion.
So moved.
And Commissioner Nunley seconded. All in favor, let it be known by this second. Madam Clerk.
Chairman McLaughlin,
Yes, approved.
Vice Chair Coulson,
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatric,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
Yes.
Commissioner Perkins Williams.
Approve.
Motion passes unanimously.
Very good. And we move to the item for discussion. And then again, Scott, on the proposed resolution regarding the reopening.
Thank you, Mr. Chairman. You have on your agenda this morning an item for discussion at the request of Commissioner Lauren White and Vice Chairman Tom Coulson, asking the board to consider some type of a resolution or movement to ask the governor to allow Pitt County to have the flexibility to determine its own reopening strategy. I don't put words in their mouth. There was a resolution that they asked to be attached, the Onslow County, as one potential example. I think there was made reference this morning to the Gaston County Board of County Commissioners that had passed a resolution. Do want to point out in terms of any county's ability to enact a state of emergency or any orders within that state of emergency only applies to the unincorporated portions of that county per se. So in Pitt County with 10 municipalities, we have no jurisdiction over the areas of those 10 municipalities, only those things outside of it. In the Gaston County example that was brought up a little earlier, there are 12 municipalities, and it came out after the Gaston County Board of Commissioners had made their action that all the 12 municipalities came out with a reverse action saying that they were not in agreement to it, and I guess they weren't included in that conversation. So I just wanted to kind of put some clarity on that in terms of what geographically, what any action you may decide to take, what would apply if you're given permission to devise your own reopening strategy. So I would open it to the Commissioner White or Vice Chairman Coulson to.
Okay, Commissioner White and Commissioner Coulson, would you like Commissioner White first, please?
Like I said earlier, the whole point of the shutdown was to slow the virus down, not to eradicate it. We cannot eradicate the virus, but we have flattened the curve and slowed the spread, as there's been a lot of talk about. It's time for local control. Pitt County, we're not any county in the east, west, or the Piedmont region. We are Pitt County, and it is time for us to be able to make decisions that are best for our county. Historically, it has always been harder for rural counties such as Pitt to come back after loss of business than more urban counties. And the whole deeming businesses essential or non-essential, who is anybody in the government to say what business is essential or not essential? Any business that puts food on the table, clothes a child, and puts a roof over your head is essential. I've also looked up some death rate statistics of my own. The death rate from an unemployed person is 63% higher than that of an employed person. Right now, over in North Carolina, there are 637,000 people out of work, and across America, there's 22 million Americans out of work right now. I'm afraid that the death rate from the negative economic impact of this shutdown is going to be far greater than what the virus ever would have been. Suicide is going to be at an all-time high. People won't be able to afford medical care and their necessary medicine. And even if it hasn't personally affected your income, it will be negatively affecting you when you go to the grocery store, because processing plants are closing down. There's no way to process the pork and the chicken that's grown. If the shelves are bare at the grocery store, we don't eat. And I would also like to point out that Chairman McLaughlin, you said that the comments during the public comment section were duly noted. The definition of duly noted is when something is noted as appropriate and justified. Yes, those comments were appropriate and justified. These people and far more have taken a huge financial loss because of the shutdown order. I don't see how we can say that we are pro-business and we're telling people that they have to shut their doors and not work. I've talked to restaurant owners who said that their revenue is down by over 50%, and they're wondering how in the world they're going to be able to keep their staff that's turned into their family employed. I've talked to salon owners and gym owners and other business owners. They don't know if they're going to be able to open their doors back up after all this is said and done. Again, we need local control because we are different than other counties. And I would also like to point out what I said at the last meeting. This was not force anyone to go back to work or to leave their home. If somebody still felt unsafe going out, they can continue to stay home. But for the businesses that feel like they can open and operate safely, they should at the very least have that option. I've wrote down a bunch of stuff, but I think that is all I have to say at this particular time.
Thank you very much. Commissioner Coulson.
I agree totally with what Commissioner White has said. I'd like to ask all the county commissioners to introspect. How many of us don't have means of income? Think about if we had $0 coming in for the last 8 weeks. 0. And looking ahead, the governor's plans are going to open up parks and recreation centers before other things because of the phase-in. I don't know why those parks were even closed in the first place. Going outside, getting fresh air, and being in the sun is helpful to killing the virus rather than staying cooped up in a house. The desperation that some people are feeling right now is incalculable. Again, how many of us have 0 income? We need to put ourselves in their shoes. Yes, we need to open and open responsibly, but to blanket say, no, you can't open, how many people are we hurting? Please, all we're asking in this resolution is to go to the governor, and basically we're saying we're not Mecklenburg County. We are not Wake County. We have a different scenario and impact from this disease here. Let us determine our own fate. We trust Dr. Silvernail and the health department to be able to help guide us in the reopening in a sensible way. But if we don't send this resolution or a resolution to the governor, as far as he knows, we're all in favor of him dictating what controls are out there. We effectively have martial law without declaring it. Is that fair? Is that right? Are we going to suspend habeas corpus? Please, all we want is a resolution that goes to the governor and says we want local control. That's all.
Okay. Thank you very much. Commissioner Fitzpatric.
I couldn't agree with Tom and Lauren more. This is something that we're going to have to learn to live with. This isn't something that's going away anytime soon. We can't continue to hold our breath forever, hoping that everything is eradicated and goes back to normal. I've also heard from several people who are struggling and need to get back to some sense of normalcy. And while all these restrictions are in place, I'm afraid that people aren't going to be able to do that, and that, as Commissioner White said, a lot of these businesses may not be able to reopen. Certainly, I'm not advocating that we just do away with all restrictions. I think, the presentation that Dr. Silvernail gave this morning was pretty enlightening in that it showed that what we did prior to this helped flatten the curve and put us in a position that we can reopen and do so in a safe manner. Not presenting this resolution, not letting the governor know where Pitt County stands, where the citizens of Pitt County stands, I think is doing a disservice to our constituents. At some point, this has got to change. People need to be able to get back to work, earn a living for their family. I've talked to several people who have even applied for the different grants and things and have been turned down later to come to find out that the large corporations and businesses are the ones that are able to get the proceeds from those programs. So I think letting them know that we can do some things on our own as a county, and who better to make recommendations and know that county better than the residents themselves, let alone somebody who's living up in Raleigh in a major metropolitan area. So I'm in full support of sending something, some type of resolution to the governor's office, and I think it's time.
Okay, Commissioner Perkins Williams.
Excuse me, Mr. Chair. I've talked about this with Dr. Sivanel earlier this morning. Yeah, I like to say that we need businesses over here. We certainly need businesses that we can visit. And I do like I usually do, get in my car and drive 10 miles wherever I need to go and get it done. I do not think we need to subject those people who are not able to address the situation and those who are not able to be able to go or do what they have to do. There are a lot of people who just can afford a lot of things. And when people are dollar driven without humanity or whatever, it concerns me. And when you hear what people say to you, when you ask them, well, do you think the virus is real? And they say no, then those people are apt to subject vulnerable people to it. I don't know. I know it's, I don't know how to address something like this other than say, let's follow the what we're doing so far and what we have led to believe is the best way to do. We do need to open up. We certainly do. I feel it. And frankly, with the way the country is shelving out stimulus payment, for which I've not gotten, and I've always been on the losing end and negative end of anything that's supposed to come. So I wouldn't have it, but I planted me some collards and cabbage in the backyard because I know that I'm going to have to live without dollars and cents in the future. So you have to start looking at common sense efforts right now, because some people are not, and they're going to do what they want to do, and you can be subject to it. So I'm sorry I can't support that.
Okay, Commissioner Ward.
Yes, thank you. I listened very closely to the report. My concern is that Pitt County has no plan for reopening. And I think if we want to come back within 7 days, I'm certainly not in favor of doing eliminating the plan now. I think we've been on the right track for the citizens of Pitt County as a majority, and I still support that. But if we want to come back in 7 days and someone bring forth a plan for reopening, which we don't have in place, we only have requests from certain people. So that would be what I would propose us doing. But I'm not in favor of us just opening everything back up as of today. Thank you.
Okay, thank you. Commissioner Floyd Huggins.
Thank you, Mr. Chairman. I'm listening also, and we've just been told that Walmart will start testing or have already started testing. So we're going to have that information to look at. So I'm willing to wait to see what those numbers are going to look like. I hear what Lauren and Tom are saying about small businesses. I got those emails too, and Tom called me to explain his side of it, and I explained my side. But I am of the opinion, and let's go back to Dr. Silverman. I believe Chris asked him if he was in communication with the governor, with the state office, and he is. With all of that information, and as Beth said, we don't have a plan in place yet. So I am willing to come back, and I'm not. I don't think 7 days is enough time. I like the 2 weeks. You know, because you have to have time to get things in. I mean, put it down and work it out, and the pros and the cons and all of that. I'm not in favor of this proclamation. So I know as again, Dr. Silvernail said, he is in communication with the state. So the state knows what our numbers look like here in Pitt County. I am not in favor of that proposal, proclamation or whatever, going to the governor. Thank you.
Thank you, Commissioner Nunley.
Thank you, Mr. Chair. I think one thing that we don't need to argue about is that there's not a single leader, not a single person, not a single family that's sitting at home that does not want to get back to normal now. And so I think the idea that we need to send a resolution to the governor to let them know that we're ready to go really cuts against the one thing that, if we're looking at hindsight, the one thing that we really dramatically failed in this country on is really showing a sense of unity in response. The numbers that don't lie are that the United States of America has well over 1 million cases. We have the highest rate of deaths worldwide, and a lot, you know, not the Monday morning quarterback, but one of the things that we missed from the very beginning was a unified response. Now, there's a very clear plan now coming from the federal government, the Centers for Disease Control and Infectious Disease, a very clear plan from the state of North Carolina by Mandy Cohen in the governor's office, the Department of Health and Human Services. And at this point, we've done what we needed to do as a county to get us into a position that we are locked and loaded, ready to go. We need to communicate to the governor that we are strong here in the East. We acted early to get to where we needed to be, and that's where we are. Passing a resolution to say that we're going to go ahead on our own discounts reality, and that the places that have not acted as a unified front have done dramatically worse against controlling the spread of the disease. We are very close as a state to moving in that direction, and we are stronger, not only as public health perspective, but we will be stronger economically by moving forward as a unified front. So I have full faith in the Department of Health and Human Services ability to take our data that Dr. Silvernail is now going to communicate to them and let them know that we're ready. And presumably the state of North Carolina, which, by the way, residents travel freely throughout our state. The state of North Carolina is going to be able to look at that. The governor's office is going to be able to look at that and say, hey, look, now it's time to move to phase 1. And these phases, these are not pulled out of thin air. These are the experts in infectious disease that have put these out, and this is what we're all going to live with. And so the argument that local control is going to get us there, that's not going to get us there. That's going to get us to second swells. That's going to get us to sporadic responses. That's going to get us to not being able to respond and see it as spiking cases, essentially what we had in the initial onset of the disease. We've gained control. We cannot cede control at this point. We have to be unified. We have to send a unified message that we are ready. We've done what we needed to do. We're going to continue to expand capacity in testing. We're going to continue to expand capacity and our ability to trace so that our consumers and our business owners, when we do reopen, can be confident that they can operate in a more traditional market setting. I know that a unified front, and it's not just me, but the numbers don't lie, we as a unified state, and Pitt County, a part of that state, will be better off than we would if we all went on our separate directions. And I cannot, in good faith and conscience, recommend to the state to allow counties to go their own way when I know that it's the unified approach that failed initially. It's the unity that we've gathered through this fight that will see us to a strong recovery, and we need to stay the course. So I'm not in favor of the resolution.
Thank you very much. Commissioner Albright.
Things. One, point person in this, and that he will be communicating these thoughts to state today when he talks. Excuse me?
Commissioner Albright.
Yes.
Will you start off again? We couldn't hear you. I think you was muted. So will you start your conversation over, please?
Certainly. I'm sorry. Yes. Just a couple of things, and I appreciate the comments. I agree with Commissioner Nunnally, certainly, that there's nobody that really wants us to stay like we are right now. We all want to get back to business, and to especially our small business people have been really slammed in this, and it's horrible. In terms of a resolution asking for county control, I think that we have in place right now Dr. Silvernail, who is our point person, and he will communicate our willingness, our readiness to move forward when he talks to state officials today, and that I have confidence that our governor is involved in those communications also. As we've heard, we've got ramped up testing with Walmart. We will have more figures later this week. We don't have a plan for Pitt County, and if we send this resolution, we are not speaking for about half the residents of the county. I believe if we could get some clarity from our county manager that there was some discussion last week about the municipalities joining in on such a joint resolution. Did I get that right, Scott?
No, I mean, there was no discussion. I think I had just pointed out that the last action that we took was a joint statement with our 10 municipalities. Was the last thing we did. So I had suggested in this, my motion to you, that you might want to consider, to be consistent with that, some type of a joint type action again, if they would be so agreeable.
Well, that certainly seems to me to be the case, that if we as a county are going to go forward with something like this, that we need all the county. We can't ask, I don't think we can logically ask that the county open itself up when the city of Greenville isn't opening itself up. And so again, I fall back to Dr. Silvernail speaking as our professional health point person here, that for him to communicate what he said to us earlier today was that it looked like we were at the point where we could start some phase reopening. That's it.
Okay, thank you very much. Commissioner White, did I see her name?
Yes, she had her hand up.
Commissioner White.
So it was logical for the county to initiate a shutdown order without cooperation with the municipalities, but it's not logical for us to initiate an order to petition the governor for local control to allow us to reopen. I feel like if we did that, other local leaders of municipalities would probably follow suit as they did with the shutdown order. I also want to say that we have actually surpassed the 14-day downward trend with 17 days. And how long is long enough to wait? Is it long enough when businesses have shut down, when they can't open back up? Is that long enough to wait? We keep talking about 7 more days, 14 more days, waiting and we're waiting and we're waiting. How long is long enough? And also, we need to think about this. If we don't support a resolution asking for local control so that we may go ahead and open back up, we're telling our citizens that we don't feel like they have common sense. Again, all these businesses have the capability of reopening in a safe way. Guidance from the state has been low. And I would also like to ask you to remember last year and what your vote was on a 3.5-cent tax increase on the budget. Think about that tax increase, how it affected our citizens last year. And now think about, are you going to vote to continue to shut down their ability to earn money? That's all I have for right now.
Okay, Commissioner Coulson.
I would just like to remind the board not to be selective in your hearing of what Dr. Silvernail said. The statistics are one thing, and the reporting, totally agree with that. But he also said that there was that he thought that there would be a means for us to be able to open in a responsible way. And so it sounded to me, and maybe I'm putting words in your mouth, Dr. Silvernail, but did you not say that you thought that we could open up in a responsible way today?
Yes, sir. Yes, sir.
I did say that.
Okay, so those that are against the resolution, again, all we're asking for is the governor to not lump Pitt County in with all the other 99 counties. And nobody's saying to open up irresponsible. And so in order to develop a plan, you have to have the authority to do so. But with the governor having a blanket executive order that comes out and affects all of us, we can't do anything until either he stops or we get an exemption. That's all the resolution asks for, is for us to have an exemption. That's all. Thanks.
Thank you, Commissioner Nunley.
Makes a fair point, and I think that what we're looking at here is that Pitt County is in a place where we can perhaps start to phase into our phased reopening. But what Dr. Silvernail is not advising us on, nor do I presume that that's what he's hired to do, is to whether or not that is not more impactful if we operate as a unified group of counties in moving in that direction. Because we allow free transit between counties, because we allow, in fact, some of the neighboring counties that have a higher infection rate per 100,000 than ours, Edgecombe and Wilson counties, a lot of folks there live and work here. Because we don't live in a closed society generally, when we start to reopen, it makes no sense in my eyes, and this is the real disagreement, to have a fractured reopening, because in having a fractured reopening undermines the entire premise of what we do when we have pandemic response. It has to be a unified reopening to have the same type of effect. Otherwise, we're not going to be able to have a strong recovery. Our local economy can't take a second hit, can't take a second swell. And so we need, especially in the East, we need to be lockstep with the counties around us so that we are best positioned to have a strong, lengthy recovery, not just through the summer, but in through the fall and winter, where there's a lot of expectation that we're going to see a higher rate of infection. So we need to act together now. And I will just to touch on Commissioner White's point. If you'll read the governor's guidance, that's come down from the Department of Health and Human Services, and this is not just coming from the state of North Carolina, this is coming from the CDC, this is coming from the federal government, the folks that are working day in and day out to have smart, level ways forward as we reopen our economy. These plans have been thought out, and they're smart. And so we, as a county, look to the state and say, hey, we're ready to go. we are ready to go. Let's move forward together. And I think we can do that without having a resolution that shows a level of disunity, and do that without saying, hey, local control is the best way forward, because any country that's responded, well, any country or any community that responds in a fractious manner doesn't have success in keeping numbers down and will not have a sustained, strong economic recovery. And I'll just leave it there.
Thank you very much. I think we've had a majority of the people speak, and we will let the other two more that have the hands up to speak, and then we're going to wrap this up and maybe take it to a vote. Commissioner Ward, then Commissioner White.
All I want to say is that I agree with you, Chris. Very well put. We're not in this separately. We're not an entity by ourselves. We are a large part of Eastern North Carolina. I think the fact that we were the first absolutely in the state to do what we did, I think that was a real good move. And any decision we make is going to relate to county proper, not the towns and the cities that are in our county. So I totally agree in the sense that we need to have a plan. That's the other thing. I have not heard a plan for reopening and gradually or whatever. So with that, I'm not going to support this motion if it's made. Thank you.
Thank you. Commissioner White.
Yes. So Pitt County calls itself the leader in the East. Maybe it is time for us to lead in this decision. A lot of our citizens are hanging on by a thread, and they don't know how much longer they can hang on. I can keep reiterating what I've said over and over and over this whole meeting. But at this time, I am going to make a motion that we adopt a resolution to petition our governor for local control, and that if, in the event this resolution passes, that we share a copy with our municipalities and encourage them to adopt the same resolution.
Okay, you've heard the motion. I see Commissioner Coulson. You second that, Commissioner Coulson?
Yes, I'd like to second Commissioner White's motion.
Okay. Those in favor, we're going to ask the clerk to now move forward.
Chairman McLaughlin,
No.
Vice Chair Coulson,
Yes.
Commissioner Albright,
No.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
No.
Commissioner Nunley,
No.
Commissioner Ward,
No.
Commissioner White,
Yes, 100% yes.
Commissioner Perkins Williams.
No.
The motion passes 7-3. I'm sorry, the motion fails 6-3.
Okay, very good. Thank you very much. We shall now move on to Janice Gallagher, the legislative goals and resolution.
Good morning. You have in your agenda package our legislative goals and resolutions progress report. Last year, the 2019-20 beginning of the biennium, we had a long session. We had breakfast with our legislative delegation to present the 8 goals that this board had previously adopted. Those goals are included within your agenda package. Throughout the course of the year, you also added 6 resolutions that directed advocacy efforts to the General Assembly to the state of North Carolina. And in your package, you have a May 20th progress report, which shows which goals have been achieved and which goals are still pending. I won't go through those with you, but I'm here to answer any particular questions you may have. You'll see a check mark next to those that were achieved. General revenue protection, opposition to unfunded mandates, adequate funding for social services program, and we achieved by Session Law 2019-106, the ability to preserve confidentiality of animal services records. Pursuant to your resolutions, we are continuing to support goals to support current control of the ABC system, to support quality health care, and to seek legislative support you were successful in achieving through 2019 Session Law 188, House Bill 724, which was the Truth in Caller ID Act. The other goals remain pending, and you see notes on your progress report as to our desire to continue to support these goals, with the exception of one which has justification for deferral, and that relates to the cow share unpasteurized milk law. I bring these to you just as a status report update. I also propose, typically, absent our COVID-19 environment, we would have had full board discussion about any initiatives that you wanted to pursue in the short session for 2020. Within your package are 3 proposed goals for the short session of 2020. The third goal, and for the public's benefit, those are to support funding for the development and implementation of pretrial services and mental health court programs in Pitt County, to seek flexibility to extend the discount period for payment of ad valorem property taxes up to 60 days. And the third proposed goal was to support legislation extending the effective date of the new revised land use law. These goals were proposed after a request from department heads to submit initiatives for the short session. Of those 3 goals, the third goal has already been accomplished. Both the House and Senate have passed a bill extending the effective date of Chapter 160D land use legislation, and that is awaiting governor's signature. So there are only 2 remaining on your list. This is your opportunity to discuss whether or not you would like county staff to continue or to begin supporting these goals at the state level, and to add any other goals that you as a board would like to see us pursue in the short session. My understanding is that the General Assembly did go back as planned on April 28th, and that this short session is slated to be a very short session with essentially emergent matters related to COVID-19. But I didn't want this opportunity to pass without the board's ability to at least revisit and provide some direction if you would like to.
Okay, I see Commissioner Perkins Williams. Thank you.
Thank you, Mr. Chairman. Great report. I like for us to continue what you're saying, Janice. But I also would like to see us, I'd like to see the county manager put some plan in place as to how we're going to open up, because we need to open up as soon as we can, but we need to have a plan. I agree with Beth. We do need to have a plan. If we say throw the doors open, we need to have a plan. We need to have a plan in place for that. So I like to see the county start looking at that. And yes, thank you, Janice. Do you need a motion on Janice?
No, it's on as an item for discussion, so the board can decide to not act on statewide legislative goals for the 2020 short session. The board can provide direction on what goals outside of your just prior agenda item that you would like me to pursue, either the ones suggested or different or additional other ones.
It would be good if we could have a vote by adding these 2 legislative goals to the short session for us to be allowed to be pursued, the discount period, and then the support funding for pretrial services, mental health court.
And if you need any further background on those, the pretrial services and mental health court, you've heard presentations from both Judge Blunt in the past and from Judge Hazelton. Those are programs that we concur would be beneficial to address the jail population. And we had hoped that there would be funding in last year's budget. There actually was funding put into last year's budget, but that budget never passed. And so there have been efforts by those judges working with the General Assembly, and they've asked the county support in continuing to find funding at the state level for these programs. Unfortunately, as valuable as they are, given the impact on the county's budget, I'm not sure And I don't want to get ahead of the finance officer or manager that this is a year where it will be realistic to expect expansion of new programs. And so to the extent we could have state support to begin implementation of these programs, I think could be beneficial to the county. On the second one, as it relates to the discount period for payment of ad valorem taxes, the law as it is currently written requires that discount to gives you, if the bills are issued in July, you have until August 30th to pay under a discount period. And then September 1st, that discount period expires and you don't have delinquent taxes until after the first week in January. This would allow flexibility at the local level to extend that discount period so that folks would have a longer period of time to pay their taxes with a discount than they do under current law. It would be a benefit for the citizens who might be feeling some economic impact at this time. If you'd like us to pursue those, then we could have a motion to adopt those two goals, and then we will provide follow-up reports as we normally do.
Okay, thank you. Commissioner Ward?
Yes, I would like to make that motion that we support the two proposed legislative goals and any of the other ones that will be presented, particularly since we got a short session. I think it's very important that we do that. That's my motion.
Okay, Commissioner Albright, do you second?
I actually wondered about what had happened to the push I thought was on a goal for Wi-Fi in the community. So was that last year's goal? It seems to have disappeared here. And we still don't have it, of course.
That is the Association of County Commissioners' number one goal.
Thank you for the clarity. Yes, my mistake. I do second this. Thank you.
Okay, we still have a motion on the floor. Do we have a second for that motion?
Commissioner Albright seconded.
Commissioner,
Albright just seconded.
okay, okay, have a second by Commissioner Albright. Commissioner Fitzpatric.
I was going to second the motion.
Okay. So just discussion and vote.
Okay, it has been moved and properly second. Madam Clerk.
Just for the record, is the motion to pursue the proposed legislative goals or just?
The two additional goals.
Okay, for the 2020 short session. Okay, Chairman McLaughlin,
Yes.
Vice Chair Coulson,
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White. Yes. Commissioner Perkins Williams.
Yes.
Motion passes unanimously.
Okay, thank you very much.
Mr. Chairman,
Did Lauren White say
Yes.
no?
do you have a question? Attorney?
Did Lauren White say yes or no? Okay, she said yes. Okay.
Just want to follow up on Commissioner Perkins Williams' comments about a local plan for reopening. In essence, with the 6-3 vote not to ask for that flexibility, by default, then you go to the governor's three-phase plan that he issued, I guess last week. Well, my email's dated the 23rd, where he's got the three phases. His first phase doesn't have a duration in terms of number of weeks. And then phase 2 lasts 2 to 3 weeks, phase 4, 4 to 6 weeks. I think all that is subject to change depending upon what information they receive. So we would be subject to what all other 99 counties in North Carolina are doing. I just wanted to clarify that and see if she had any other input she wanted to make.
Okay. Commissioner Fitzpatrick.
Thank you, Mr. Chairman. I would like to ask the responsible parties to come up with a plan in the event that we are able to, in the next 5 to 7 days, revisit this issue and have something put in place at a time that we further that discussion. I think that would be prudent to do so.
I will say I have talked to the Greenville city manager, and she is saying that the city is looking at some ideas of not that they're proposing a reopening strategy above and beyond what the governor is calling for, but considering most of this would affect those businesses who are in municipalities, I'll be happy to confer with her or them. We have our next weekly conference call Wednesday at 1 o'clock. Can bring this up to the group at the same time and have that discussion.
Commissioner Nunley.
Thank you, Mr. Chair. Manager Elliott, just wanted to see if my reading's correct, but based on your report, we would default back to the governor's plan with this resolution not passing today. And if I'm not mistaken, in phase one and in some of the various phases, local municipalities still have the ability to put in phase one, still have the ability to enact more stringent guidelines if they feel that if their communities are not ready to move as quickly as the governor's order. The governor's phase one approach is really about setting the floor about which that everyone is able to operate, but counties still have flexibility to enact more stringent regulations if local control deems that is warranted. Is that correct?
That is correct. Whether counties or municipalities, we both have the ability to enact more stringent controls. In phase one, really kind of continue everything we're doing other than the reopening of parks. I mean, it is in continuing the rigorous restrictions on nursing homes and congregate care facilities, which we would hope and expect. But really phase one, for the most part, continues the operating environment we're in today. It's really until you get into phase two and phase three that things start to let up.
Thank you.
Good. Commissioner Perkins.
Scott, I would like to know, will the Wednesday meeting be televised, the one that you have with the municipalities?
No, that's basically a closed call meeting of the municipalities and some community partners. We don't Zoom that, or we don't broadcast that.
So we don't have a listen to?
At this point, we don't have elected officials on there.
Okay.
More of a kind of a staff level, managers and such.
Thank you.
Okay, we do have a motion and a second. Have we done it? Okay, very good. Thank you very much. All right. We should now move to Scott with the interlocal agreement with the city of Greenville.
Thank you, Mr. Chairman. So this item is being brought back at the request of a board member, Commissioner Vice Chairman Coulson, from the last meeting, had brought up that since 1999, Pitt County government has had an interlocal agreement with the city of Greenville regarding 2 of the 15 member slots on the Pitt County Industrial Development Commission. And gives them the opportunity to nominate 2 people that can then come before you to accept or reject in terms of a nomination format. In 2015, the Development Commission amended their bylaws that designated a number of seats for certain attributes such as PCC, ECU, Vidant, and then there's one for the remaining one for the city of Greenville. And then you've got your last one would be for the Pitt County Commissioner. So of the 15 seats, 10 are at large, 5 have an attribute to them. So right now there's an inconsistency between the bylaws of the Development Commission and the interlocal agreement. And we're bringing it before you to ask you what your desire is to maybe clean up the inconsistency. We keep in mind the Development Commission has the legislative authority to and power, I guess, to have in their bylaws what they deem necessary as operating guidelines for them to operate. It's been suggested that the commissioners change their bylaws, but you don't have that. It's not your responsibility or your ability to affect those bylaws in that manner. So you've got before you this, and I think I did send out to the board 3 options to consider in terms of addressing the interlocal agreement. The first option is to honor the agreement as executed in 1999. If that were to be done, that the clerk would need to make a formal request to City Council to take action for a nomination for the second seat. And keep in mind, of the 15 seats, 1 is vacant today. Also, you need to request, the commissioner would need to request the Development Commission to amend their bylaws so they're only designating 1 seat versus 2. I'm sorry, 2 seats versus 1 within their bylaws. So that's option one. Option two would be to amend the interlocal agreement so that it matches the Industrial Development Commission's bylaws, which designates only one seat. If that were to be done, we would then it would then be recommended to request the city of Greenville to concur with this change, that the interlocal agreement be amended. This would be a formal process where both parties would have to agree to it. The third option, which is in my, from my perspective as manager, least preferred, would be that of terminating the interlocal agreement. Keep in mind that that can only be done with a 60-day notice per the existing agreement you have with the city of Greenville.
Okay, very good. Commissioner Ward?
Yes, Scott, when you say, I mean, could you elaborate just a little bit on the consideration that you said you were supporting is really kind of like it has been in the past. I know that we've been working on some of the changes that have taken place with the Development Commission. One of them, which was just kind of, I don't even know when it started, I think back with our last development person that we had here, was it if you can get 3 of the Development Commission people together, whether it's by phone or face-to-face, they can make decisions based on their vote instead of the entire group. And there's some of those things I think that need to be cleaned up. And I think the attorney has been looking at those, not major changes, but sort of going back to the way things were. And this, Scott, with that said, would you elaborate a little bit on that third choice?
Sure. Let me just back up to your first comment in terms of the recommendations to amend their bylaws. The Development Commission had a workshop probably 3 weeks ago. The county attorney and I attended that. It was a Zoom workshop. At that meeting, the bylaws was one of the topics on that workshop agenda. She ran through what their bylaws state as amended from 2015. She also verbally presented to them changes that we've been talking about for a good 12, 18 months, everything from what constitutes a quorum. Right now, basically, I think it says any number of people who show up basically constitute a quorum. Unless somebody who shows up objects to it, then it would be a simple majority, which would be 8 of the 15. Another one in there was how whether the vice chair versus the chair could call a called meeting. Janice, can you recall the other changes we had in there? I can't, off the top of my head, I can't think.
We had 3. It was the quorum, the vice chair's ability to call a meeting without the chair being absent, and a nominating committee as an advisory recommendation from the board when seats are vacant.
So after that, just to follow up on this, after that, the county attorney actually typed all these proposed changes up into a formal document. We presented that to the Industrial Development Director, Scott Darnell, as well as Chairman Kim Bell, for them to consider taking back before the Development Commission. So right now that sits in their, with them to take back for consideration. But regarding option 3, the termination of the interlocal agreement, basically it is just as it reads, that is always your prerogative. You could terminate that interlocal agreement. You would have to provide the city 60 days notice as required in the interlocal. And then if that were to be the case, then after 60 days, the interlocal then would go away. I don't know if the county attorney has anything else to add to that, or.
No, and if the interlocal goes away, the Development Commission bylaws remain in effect, so that there would still be, according to the bylaws, 1 seat with an attribute for the city of Greenville. And that would be appointed within the discretion or by the Pitt County Board of Commissioners. The way the interlocal agreement reads, the appointments for 2 seats are made by nomination by the city of Greenville. That can be accepted or rejected. And so if you honor the interlocal agreement, then you must accept or reject the nomination from the city of Greenville. If you leave it the way the bylaws is, the appointment remains in the discretion of the Board of County Commissioners. However, 1 seat has an attribute for the city of Greenville.
And if I can add too, and also ask our PIO to pull up a map we have the county showing, illustrating the different areas in which folks who serve on the Development Commission, where they live. Thank you. Also on page 28 and 29 is a list of the Development Commission board members, the 15 different slots, again, on page 29 is your vacant slot. But we've marked on here, it's kind of confusing, but everything from the attribute of their at-large seats, the seats that have or 10 at-large seats, the seats that have an attribute, basically being 4, and then the City of Greenville seat. And then also we marked on here whether each individual is within a municipality or outside a municipality. And you can see on the map before you, we've got all the right-hand column in the legend, all the different members of the Development Commission listed, last one being vacant. And then we show in the darker areas would be the municipal city limits. The yellow is ETJ. There was a question came up about how many actually live in an ETJ. Right now I count 1, 2, 3, 4, 5, maybe 6 in there. And then you can see their distribution by the red dot in terms of where they reside.
Okay. Commissioner White.
My personal thoughts on this is we should be more focused on the characteristics and qualities of who we appoint. We shouldn't be worried about the location and where they're from, but we should be worried about finding the people who care the most about Pitt County and who want what's best for Pitt County and who are most qualified to sit on that board, regardless of their location. Thank you.
Okay. Commissioner Floyd Huggins.
Mr. Chairman, I would like to offer a motion, if it's in order, that we accept option 2 with the cleanup from our attorney.
Okay. There's been a motion to accept item 2. Do we have a second on that? Commissioner Ward?
I'd like to second it, I think, but I'm not sure that, are we going back to the plan as it was originally? Is that what we're saying?
No, option 2 is actually the option where you would ask the city to amend the interlocal agreement where they would only nominate 1 individual versus the current 2 as stated in the interlocal agreement.
And we do have that. I mean, we did have that in the original one, correct? One person.
The agreement called for 2. This would just have 1.
Okay. Well, I second that motion.
Okay, it has been moved and properly second. I do see Commissioner Nunley hand up.
Yes, I just really, this is maybe a question for Commissioner Fitzpatrick, who sits on the board. Didn't know if there was any indication that there's a preference from the PCDC board about which direction, is gonna be able to keep, I guess, the best direction forward. And if not, I'll just retract my question, but just wanted to know if there was any direction from the executive director of the PCDC or the entire board about what they would prefer see happen under this situation.
Okay, Commissioner Fitzpatrick, you'd like to respond to that?
Sure. So I think at this point, there's been a lot of concern raised by the chair that to make sure that, or I guess the emphasis was put on having people from different municipalities in different parts of the county as representatives on the board. There's still some discussion of whether or not that's what in fact is the actual will of the board. I think that's something that's going to be brought up this coming week. I think we have a meeting scheduled for Wednesday. And I would echo Commissioner White's comment that quite frankly, I don't really care where someone lives in the county that's going to be a part of any board for that matter, as long as they're the most qualified candidate for the position and have the best interest of Pitt County at heart. So I think that's something that, to answer your question, Chris, is going to be clarified here shortly.
Well, I'll agree with you, and I'll just thank you for your representation there. Thank you.
Thank you, Commissioner Coulson.
Okay, for clarity, this is concerning the interlocal agreement. Is that correct?
That's correct.
Then I'd like to make a substitute motion that we go with number 3, and that we exercise our option to make this agreement null and void in 60 days. And the reason for that is because I think it's redundant, and because of the duplication, it's no longer necessary. The bylaws of the Development Commission are that they will try to spread out the, I'm going to say, representation, and the way they do that is in the section 3 of their bylaws, where it calls for members, 15 members, and that the East Carolina Pitt Community College, Vidant Medical Center, and City of Greenville, they can each nominate a representative. That representative then comes before the Board of Commissioners, at which time we can either accept it or ask them to propose another. I see no need in continuing this interlocal agreement. I believe it has outlived its usefulness. So that's my motion, to go with option 3.
Okay. Thank you. Do we have a second on that?
You have 3 hands up.
Commissioner Perkins Williams. And
Thank you, Mr. Chairman. In looking at the composition of the board and knowing what we have to face in Pitt County, I think it is important that this particular board be widely represented, and that we as commissioner will search our district and make sure we have people with background and are able to discuss this. This district has been left out of the situation for a long time, and District 6 is heavily populated with all the boards. And that's not to say that we are not a county, it's to say that we need to be inclusive, and we need to be concerned, because we all don't live in everybody's moccasin, and there needs to be a difference. And a variety is really a strong point for the county as a position. Our next question is that vacant seat, a voting seat. Sometimes at large, I've learned by being appointed to boards, at large, you're not a voting right. You don't have voting right. Is that a voting right seat, Mr. Manager?
Yes, all 15 are voting seats. And actually, I just want to point out, we do have, that was a District 2 seat, and we currently have a District 2 seat. So we have 2 of the 15 that do represent District 2, north of the
Thank
river.
you. I am in the process of looking for someone and talking to people who are willing to attend the meetings and represent the district on this board. Thank you.
okay, thank you. Commissioner Flora Huggins.
Thank you, Mr. Chairman. As we talk about districts, I see that there's only one person from District 1. And I think that the whole county should be recognized or represented, rather. In addition, yes, we want quality people on the board, but we also don't want to leave out certain parts of the county. And when I looked at option 2, and my reason for saying that was to say that the board, I believe that was kind of their option, or the better option of the 3. And I don't think we should get into another disagreement, maybe too strong a word, with the city with doing away with it. But I think we need to keep option 2, keep the city involved, but also work on the piece that Janice recommended to kind of clean up the some of the parts of their bylaws. and which deals with the quorum. I think there should be a certain number and not just who shows up. I think that calling a meeting should be upon the chairman's right to do, instead of anybody, or especially if the chairman is present and is able to call a meeting. I think the chairman should be able to do that. So when I said option 2 with the cleanup from suggestions coming from the attorney, that is why I said that. So I stand with my motion.
Okay. I see Commissioner Coulson, then Commissioner White.
Bear in mind, we aren't talking about the PCDC bylaws. That was put in there as reference. We're talking about the interlocal agreement. That's a separate issue. Is that interlocal agreement still needed, since the bylaws, which the Development Commission, excuse me, I got a frog in my throat, which the Development Commission controls, not the Board of County Commissioners. So to try to mix in that there should be changes made with the bylaws, which I fully agree, that has nothing to do with the proposal here. The proposal here has to do with the interlocal agreement. And please keep them straight. That's all I ask.
Okay. Commissioner White, then we'll go to a vote.
I have a couple of questions, and then I think I'm ready to make a second. So even in doing away with the interlocal agreement between Greenville would still have representation on the board because they are part of several districts in the county, correct?
Correct.
Okay. I want to restate what I said earlier, that I think we should be more focused on the person and their qualifications, and if they have the best interest of the county at heart instead of where they live. And I would like to, and also Tom's motion, that will make it where we don't have to worry about where anybody is, where they live at, correct?
Correct.
Okay. I would like to second Commissioner Coulson's motion.
Okay. It has been moved and properly second on the Commissioner Coulson recommendation. Now, Madam.
Vote on the substitute motion first, which
Okay.
is Commissioner Coulson's, if you want to vote.
Can we read that, what that motion is, so the board is aware of what they're voting on?
The substitute motion is to terminate the interlocal agreement after providing a 60-day notice to the city of Greenville. So
Okay.
Chairman McLaughlin?
No.
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 Vice Chair Coulson?
Yes.
Commissioner Albright?
No.
Commissioner Fitzpatrick?
No.
Commissioner Floyd Huggins?
No.
Commissioner Nunley?
No.
Commissioner Ward?
No.
Commissioner White?
Yes.
Commissioner Perkins Williams?
No.
So
No.
the motion fails 7-2.
Okay. Does that revert back to the
Original motion.
original motion?
The original motion made by Commissioner Floyd Huggins, seconded by Commissioner Ward, is to amend the interlocal agreement to match the Industrial Development Commission's bylaws, which designates only one seat to the city of Greenville. If chosen, it would be recommended to request that the city of Greenville concur with the change and that the interlocal agreement would be formally amended by both parties. Chairman McLaughlin.
Yes.
Vice Chair Coulson.
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
No.
Commissioner Perkins Williams.
Yes.
Motion passes 8-1.
Very good. Thank you very much. And now we'll move down to the item for decision reappointment of the Sheffield Memorial Library. Scott.
Yes, Mr. Chairman, we have another reappointment to the library board, Veronica Robinson. Her name came up at the last meeting. We now have a formal recommendation from the library director, Greg Needham, for her reappointment. We have a motion and a second.
We got a motion, see Commissioner Perkins Williams.
I wanted to say something, we got to this, but I can make the motion for that, but I want to know if I can continue looking for that district, that vacant seat.
Yes, I mean, any of the commissioners, anybody from Pitt County can apply for that at-large seat.
Well, that's what I want to know. Yes, I make a motion that we accept Veronica's recommendation.
Commissioner White,
I want to second that motion.
second. Okay. All right. I see Commissioner Ward.
No, I was going to second the motion. Thank you.
Okay, it has already been second. Okay, all in favor, Madam Clerk?
Chairman McLaughlin,
Yes.
Vice Chair Coulson,
Yes.
Commissioner Albright,
Yes.
Commissioner Fitzpatrick,
Yes.
Commissioner Floyd Huggins,
Yes.
Commissioner Nunley,
Yes.
Commissioner Ward,
Yes.
Commissioner White,
Yes.
Commissioner Perkins Williams.
Yes. Yes.
Motion passes unanimously.
Thank you very much. Now we're going to go into the commissioner comments. Let me say, I want to appreciate all of the commissioners for your consideration on reopening the county. I don't think there's any commissioner who do not want to see the progress of our small business. Certainly, I own a small business for about 25 years, and I understand the need of small business surviving. However, I think that it's very crucial that we follow the guidelines and the recommendation of our experts, Dr. Silvernell, Dr. Waldron, and other experts that are telling us we are doing good, we're doing great. Our lives in Pitt County has been saved because we have followed these guidelines. We paid attention to social distancing. We paid attention to wearing our masks, washing our hands, personal hygiene, and really considering the crowd reduction. So I think that we need to continue to do this. And I think that this county would be open in an expeditious fashion. So saving lives is certainly more critical than anything that we can do. Saving one life, that life could be yours. So we need to continue to follow that and abide by those principles. Having said that, we'll now go to Madam Clerk.
Vice Chair Coulson, do you have any remarks?
No comments.
Commissioner Albright,
No, thank you.
Commissioner Fitzpatrick,
No comment.
Commissioner Floyd Huggins,
No, thank you.
Commissioner Nunley,
No, thank you.
Commissioner Ward,
No comments.
Commissioner White.
I would like to say. First, let me say that I was very disappointed with the result of the vote this morning regarding the resolution for local control. The result of this vote not only failed to pass a resolution requesting that our governor permit our county to fully reopen for business, it also failed to support the hardworking men and women of our county who own and operate the many small businesses, restaurants, barbershops, hair parlors, and places of worship. Secondly, as a result of this vote, we have emphatically demonstrated to our pastors, shopkeepers, entrepreneurs, and all the citizens of Pitt County that we do not trust their judgment or expertise to put into place the necessary safety precautions necessary for our county's economy to fully mend and recover. Finally, and personally, I have received multiple calls, emails, texts, and Facebook messages from the many owners and proprietors from all across Pitt County seeking a champion to make our state and county officials understand the urgency of reopening our business community. It has been my honor to serve as that champion this morning. My only regret is that the vote came up short for them, but I want them to know that their voices were heard. Thank you. That's all I have to say.
Thank you very much. Could I have a motion for adjournment?
I didn't get a chance to say anything.
Commissioner
I
Perkins
think I
Williams?
have a comment. Mr. Chairman, you left me off. Am I still on the board?
Commissioner Perkins Williams.
That was a
proceed.
joke. Mr. Chairman and Vice Chairman and members of the board, I have confidence in this community. But one thing that tells you whether or not people will do what they plan to do, the residents of Pitt County, all you have to do is look at the trash along the side of the highway. It is against the law to throw trash out. It is against the law to have trash on the back of your truck, and when you ride somebody's trash, go out in front of your face. Yes, you may be tired of listening to this, but can you imagine the germs and diseases that accumulate and grow inside of that trash along the highway? So I would like to encourage all of you, because snakes are out and the mosquitoes are growing, and we have a problem with trash in Pitt County. So please be conscious of your trash and keep it with you until you get it to a trash dispenser. Thank you so very much. Stay safe. Be well.
Thank you.
Move it.
Motion. A motion by Commissioner White. And we have a second. We have a second to adjourn. Commissioner Floyd Huggins, seconded.
Second.
Okay. We're now all in favor?
Chairman Ballhorn?
Yes.
Vice Chair Coulson?
Yes.
Commissioner Albright?
Yes.
Commissioner Fitzpatrick?
No.
Commissioner Floyd Huggins?
Yes.
Commissioner Nunley?
No.
Commissioner Ward?
Yes.
Commissioner White?
Yes.
Commissioner Perkins Williams?
I'm with Commissioner Fitzpatrick.
So motion passes 6-3.
Thank you very much. We're now adjourned. Thank you.